Good evening. Welcome to America's Heroes Group Roundtable Live Stream Digital Media Show. I am your host, U.S. Army Iraqi Combat Medic and Flight Surgeon Colonel Dr. Damon Arnold, U.S. Army National Guard retired. We have a guest panelist that I've had on before. All I can say is that this is one of the remarkable people at Kaiser Family Foundation. She is a senior correspondent, Julie Appleby. And I read her articles all the time now. She doesn't know, but I'm a fan. But the Kaiser Family Foundation is the health policy, research, polling, and news organization that includes KFF Health News. And this is a really incredible article you've written. And I have so much to talk to you about this. But the discussion is going to be about Julie's KFF Health News article. And it was written on January 31st, 2025. I advise you, I admonish you, go and read her article. But it's Trump's order on gender-affirming care escalates reversal of trans rights. This is a really deep issue. You know, one of the things is that we have democracy requires openness. So the town square test is, having public debates and discussions and being able to have freedom of speech. Being able to vote people out if we think that people are not fit for what they're doing, and watching out for minority rights. That's a test. But these are required an independent judiciary that is intact to make sure. But the media, what Julie is doing is so important to bring the topic forward in a democracy and to have freedom of speech. So there's an executive order protecting children from chemical and surgical mutilation. And I'm going to hand it over to Julie because what she's written is truly remarkable. Hi, Julie. How are you?
Hi, good. Thanks for having me on.
Okay, great. And, some of the things that you were mentioning is that it requires congressional or regulatory actions to be fully enacted in order to have this particular executive order implemented. And it's really a chilling effect that you were mentioning about this type of thing. The advocates are sort of up in arms about its effect on not only the delivery of healthcare services, but also insurance claim problems that can arise from this as well. So why don't you tell us a little bit about the article and how this is really fitting into the new way that the administration is approaching things with executive orders?
Yeah, let's talk about that. So this is, like you mentioned, is an executive order. Mm-hmm. And the order itself aims to prohibit government-funded insurance coverage of what are called puberty blockers and other hormone treatments or surgery for people under the age of 19 who want to change their gender. So it was an order that came out, and like a lot of executive orders, it's fairly broadly written. Mm-hmm. We talk. Would you like to talk about the order, or let's talk a little bit about what are executive orders, right? I mean,
right, sure,
what are they?
Yes.
There's something that the president has the power to do, and President Trump has issued quite a flurry of executive orders across a whole range of areas. Mm-hmm. In the healthcare arena, I think on day one, he rescinded a number of orders issued by his predecessor, President Joe Biden. Those orders had promoted lowering drug costs and expanding coverage under the Affordable Care Act and Medicaid. So he did that, and he's done executive orders pretty much every day since then. Mm-hmm. And these are signed directives from the president that direct agencies to take specific actions or to stop doing certain things. So some of that might be immediate. For example, we saw federal agencies, for example, immediately begin scrubbing the term gender from government documents and web pages following one of these directives, one of these earlier directives. But a lot of times these types of orders often require new rules or even legislation, and that can take weeks or months. So just because something's in an executive order doesn't mean it goes into effect immediately. And also remember, federal courts can be called on to review executive orders and determine whether it's a valid exercise of the president's power. So, for example, during the first Trump term, federal courts ruled that his administration did not have the authority to issue an executive order withholding federal funding from sanctuary cities. So we see these a lot. Every president does them. President Trump has been very busy with these executive orders. And so I wrote about this one from last week.
Yes, yeah. And he had one executive order defending women from gender ideology extremism and restoring biological truth to the federal government. And it's defining, our who we are as either being male or female. And, so using the word, sex instead of the word gender,
Right.
which really, changes the conversation. And one of the things I'm astounded by is that there have been, orders coming out from the CDC to remove all research related to the use of the term gender. So going back in history and going forward, you can't use gender and certain terminology when you're reporting scientific data. So we're going to lose a significant amount of scientific data just from the accessibility standpoint on the websites.
Right. I haven't written about that topic, but I have seen other stories that many government agencies are busy, scrubbing certain things from their websites and changing things. And the word gender is being replaced by the term sex, so that it will be male or female. And then gender identity is being removed from some things. But again, I haven't written on that specific executive order, but that's part of a lot of them that are out there. So this one directs the Secretary of the Department of Health and Human Services to, what it says, take all appropriate steps to end insurance coverage of these gender treatments for people under the age of 19. So this goes up to the age of 18, and that's a little unusual because 18-year-olds are generally sort of considered able to make a lot of their own choices and such. So they're not usually lumped in as children. They're usually considered adults in some of these situations. But anyway, this executive order says it would apply to those under age 19. Mm-hmm. And so who might be affected? And again, this is aimed at insurers. So the executive order specifically names several government programs, such as Tricare, which, as you know, serves the military and its dependents, Medicare and Medicaid, federal and postal health benefit programs, and the Foreign Service Benefit Plan. So it directs the Department of Defense and the Office of Personnel Management to draw up rules, which is, we go back to the thing, they got to draw up rules or other guidance to accomplish what the executive order calls for. And remember, Medicaid programs are in every state. Medicaid is the federal state program for low-income folks and also covers a lot of people in nursing homes. But Medicaid programs vary pretty widely, with some limiting or setting restrictions on the type of care that can be provided to minors in just over half the states. The type of care meaning in transitioning from one gender to another. So already about half the states have some kind of limits on that for minors. So it's unclear exactly how this will all play out. But again, it's going to go through some kind of rulemaking, and those kinds of details will be spelled out in those rules. And right now, it's kind of unclear if it affects the Affordable Care Act coverage. And that's the plan that people who don't get job-based insurance can go out and buy their own coverage through the Affordable Care Act. So it's not clear if that's included in this directive or not. So again, we'll know more when we see what rules come out around this.
Yeah, because even the Affordable Care Act, there's been some, I think the president vowed to, dismantle that and to get rid of it as well. So we don't even know down the road what's going to happen with those forms of, insurance that are needed by so many people. But, one of the things that it was really worrisome to me, too, is that in your article, you were mentioning something that is sort of reminiscent of what happened with abortion, where people who were providing abortions were sort of singled out as providers and they could be prosecuted and that kind of thing. But the DOJ, it's been instructed to prosecute teachers and school officials, who help the trans children transition, including by using their preferred names. This is really bizarre. I'm not sure of how you would enforce that. Whether you have people sitting in the classroom or monitors going around now, sort of like Gestapo, I'm not sure. But this is really bizarre.
It does call the Department of Justice to to do a number of things, and some of his other executive orders do as well. But it's around this idea of, can teachers use the pronouns that the kids want, or change like if James wants to be called Jane instead, would that be prosecuted? But then you raise a good question: how would they know? What form would that take? And again, this is an order directing the Department of Justice. We don't know how they're actually going to do it. One other thing, it does direct the Department of Justice to work with Congress to promote legislation that would allow children and parents what's called a private right of action, basically the ability to file a lawsuit against medical professionals who provide transgender care. And it also directs the Justice Department to consider the application of existing laws to people who provide or promote access to gender care. They cited fraud statutes. For example, if anyone is providing what's called misleading information about the long-term effects of gender transition. So there's a lot packed into this executive order, like many of them. So you brought up an interesting point, but that's certainly part of the order.
Yeah, because one thing is they were saying issue passports to identify, Americans only by their genders assigned at birth. And, one of the things that, being a physician, one of the things that came to mind right away was, you have cases where you have ambiguous genitalia and all those things where they need gender-affirming care, to make sure that they're transitioning into, that kind of. So, I think they should really stay out of medicine, but that's another story altogether. And one of the things you mentioned was like, approximately, it was a study from the William Institute from the UCLA Law School, but about 300,000 American children, 13 to 17 years old, were identifying as transgender. So that's a large number. So it's something that we need to deal with and contend with in the medical community. And of the 330 million who filed claims that were filed from 2017 to 2021, less than 15,000 patients, 6 to 17, with a diagnosis of gender dysphoria received gender-affirming hormone therapy, and less than 5,000 had started puberty-blocking medications. So when you look at the total picture of things, it's not just the medical care people are receiving. They're putting claims in, but they're not receiving this care. It may be that some of these claims were denied, or that they were putting these claims in just for medical care in general. I'm not sure of how those sort of played out. That now I have gender dysphoria. There's certain things I need some therapy, or how to deal with these different issues. So it seems like they are sort of pushing everyone into the same basket to also, from what what the reports are looking at.
Well, the executive order would say that insurers can't provide that type of care. So what this study looked at was how many people under 18 are currently getting that kind of care. And this was actually there was that estimate from the Williams Institute that there's about 300,000 American children ages 13 to 17 who do identify as transgender. And then another survey, this one done by Reuters and Komodo Health, they looked at, like you mentioned, those health insurance claims, and they were just looking at certain things. So they were looking at those who had received sort of gender-affirming hormone therapy, and there were about fewer than 15,000. And so gender-affirming therapy generally occurs after a child starts puberty blockers. So puberty blockers stop the process of puberty. Gender affirming would reaffirm that the child wants to have puberty as the other sex. So those were those numbers. And so about 5,000 in this study had started puberty blockers, and the remainder had been on the other type. The same survey found there were relatively few surgeries, because surgery is another treatment that is mentioned in this executive order. And they said there were just over 800,000 surgeries among those 13 to 17 during that 3-year period. Remember, all these numbers are from a 3-year period. It's not per year. It was a 3-year period.
Okay. Yes. Yeah. But that's just really interesting. So, in essence, if they do this, those people who are already receiving care, I'm wondering, are they going to stop it now? I mean, that can have really deep psychological implications for the people who are receiving care or who are, currently under therapy. So it's almost like pulling the carpet from underneath them after having gone through this. Yeah.
There's already been a lawsuit filed to challenge this order, and one of the plaintiffs in the lawsuit was a woman who has a 17-year-old daughter, and she said she moved her daughter from Tennessee to Virginia, as a matter of fact, because Tennessee, she couldn't get Medicaid coverage of it in Tennessee for her child who wants to transition. So her child's 17. They moved to Virginia. She had an appointment with her daughter to go in for a treatment just days after the order was signed, and the hospital canceled that appointment. So she's one of the folks in this particular lawsuit that has been filed. There's also been, even though the executive order mostly talks about health insurers, remember, it also says that any hospital that doesn't comply risks losing their government funding, including like research and educational grants, and they could potentially lose their ability to participate in Medicare or Medicaid. And that's a really big deal for hospitals, because most hospitals rely heavily, particularly on like Medicare funding, as a big part of their budget. So they're watching this very carefully, because this could be a big threat to their bottom line. So what some of the advocates were telling me for my story is that this could have a chilling effect, even if the rule doesn't specifically target hospitals, or doesn't, if they run the risk of losing some funding, it could have a chilling effect. So that's what we saw in this lawsuit that was just filed. But we also saw a story in the New York Times from Saturday that a hospital system there in New York had also canceled. They mentioned appointments for two 12-year-olds who had been scheduled to receive these implants that dispense puberty blocking medications. So that was on Saturday. And then on Monday, the New York Attorney General sent out a letter reminding hospitals that they must follow state laws, including those that prohibit discrimination against individuals. And so that letter said, in part, that, quote, electing to refuse services, such as withholding the availability of services from transgender individuals based on their gender identity or their diagnosis, while offering such services to cisgender individuals, is discrimination under New York law. So in New York, at least, they're telling these hospitals, wait, you can't start canceling these appointments for that reason.
That's fantastic. I'm glad that they're standing up, and sort of doing some pushback. And also the executive order directs the Department of Health and Human Services Secretary to take all appropriate steps, right, to end insurance coverage of all the such treatments that you were mentioning. But it's affecting things like Tricare, as you were mentioning, Medicare and Medicaid. You have the federal and postal benefits plans and foreign service benefit plan, being affected. And those are some people that are critical for the operations within this country. So you have many people who are transgender that are holding positions honorably and doing, professional work at a very high level of competency, and to affect them directly. That was really bizarre that they would allow that to happen, because that can also affect the infrastructure of our organizations and our universities, and because people are involved in multiple things in our military, right? So this has implications that are almost a betrayal of their trust in the healthcare system and in the system in general about being employed.
Right. It's among a number of orders. There was a different order signed earlier that is expected to lead to transgender people being banned from the military service. So that order directs Defense Secretary Pete Hegseth to come up with a new policy on the issue by late March. And in that particular order, the president wrote and asserted that being transgender, and he wrote, quote, conflicts with a soldier's commitment to an honorable, truthful, and disciplined lifestyle, even in one's personal life. So there's been some reaction to that. Obviously, so in totality with all these different orders, there's definitely the President Trump is not supportive of transgender transitions and government-funded programs. He wants the Defense Secretary to come up with a new policy on the issue of transgender people serving in the military. So there's all of these things going on, and this, likely resonates with some of the folks who voted for him, some conservatives. You remember transgender issues were a big flashpoint during the campaign. Think about the debates over bathroom usage or trans players on school sports teams. So this is definitely something that folks support on one hand, but on the other hand, it's also drawn a lot of concern from other groups, from advocacy groups like Planned Parenthood, transgender rights groups, and the families that might be affected with these kinds of decisions. So, for example, there's a lot of fear out there. I spoke with the father of a transgender child who asked not to be named because, frankly, he's very worried about being attacked politically or otherwise if his name is out there. So we didn't use his name. But he said he and his wife cry every night about sort of the totality of all the actions aimed at trans people. And he told me that he feels he cannot keep his family safe from the government, basically. He's thinking of leaving the country. And he notes that sort of historically, when a government goes after one minority group, it often does not stop there, but targets others. So that's another side of this, is that people are saying that. And I don't know if you saw the story. There was a story in Time magazine last week by Patricia King, who she's described as a retired infantry non-commissioned officer who served 20 years in the U.S. Army, including 3 combat deployments to Afghanistan. Her piece says that she was the first openly transgender infantry soldier. And she said that distinction, she wrote, didn't inherently make me a better staff sergeant, but neither did it make me any less capable. And she went on to say that, I have served my country. For 2 decades, I wore the uniform of an American soldier, deployed to Afghanistan 3 times, and led troops in combat. I didn't do it for politics. I did it because I believed in the values the military claims to uphold: service, integrity, and leadership. And you could read through it. I mean, so we're getting a lot. There's a lot of discussion, I think, out there on this issue. And like I said before, until we get a lot of the rules, we won't know exactly how this is going to play out. And these executive orders, as some of the others, are being challenged in court. So there'll be court cases too. So it's really unclear exactly how all of this will play out.
Yeah, and that's the thing that it's in the geopolitical arena, and people have their own certain views about this gender affirming care. But the one thing I'm fearful of is it gets to the heart of what you were saying, is that transgender youth will be demonized, and the spread of misinformation and disinformation about gender affirming care will start to circulate through the media and through online chats and the bullying and all those things that are in the background, which can be a very explosive environment for those people who are going through the gender affirming care. And so, I'm hoping that people are a little bit more rational, hopefully, and start understanding that these are human beings. These are American citizens. And they, and as I was mentioning, in the beginning when we first started talking, that, democracy involves an open system. And, if you have a closed system and you start doing things in a clandestine ways and putting all kinds of rules in, you start getting rid of things like the town square and the ability for people to express themselves, and your First Amendment rights, and the sanctity of your own self and your self-determination and agency, and and then making sure that people are voting and are in fair and free elections, not sham elections. And then minority rights. So this minority rights test is something that this is what you're alluding to, that there is a need to make sure that we protect those viewpoints of people who are in the minority. I was actually joking with someone in a segment just prior to this, and I said, well, the military is really a minority too. It's less than 1% of people actually serve in the country. And he started laughing, but that's the truth. And we are going to be really heavily dependent on the having an independent judiciary, because that is really what underlies all three of those platforms. The essential features of a democracy. If we don't have the judiciary acting in a correct way, or it is being cajoled to make a decision that is outside of the realm of what is legal or what is ethical and moral, we are going to have difficulties, going forward. So
yeah, we're going to see this play out across a lot of different realms, and certainly some of these questions are being raised in court already. So some of these rules are being looked at, and we'll see.
Okay, we have one more minute. We have 1 more minute to go, Julie. I'm going to let you go ad lib and stress some of the things that you think are important for people to pay attention to. Should we be writing our congressional members? What should we be doing?
Oh, I can't tell people what they should be doing. Except I think, like you, I really appreciate you having us on the air to talk about our stories. People should read, keep up with the news, follow what's going on, read a variety of news sources. I think that's you hit on that. It's freedom of the press. Read, inform yourselves. People are going to have different opinions and all these things, obviously, but the way to get at that is to know what's happening and to keep up with that. And that's where your program and others really play a role in getting the word out.
Great. Thank you so much, Julie Appleby. I know you'll be back, and because I'll be reading all of your articles. But you do a wonderful job. Thank you for doing what you do for the country and keeping us informed.
Connect.